How many medications a day do you take? Maybe the multivitamin or an ibuprofen every once in a while to cure your headache. Now imagine revolving your entire life around taking those medications in order to only have a little bit of simple relief from the pain you feel every single day. We've all come home from those Mexican restaurants with the terrible stomach aches, where you have to lay down and take a few Pepto or Tums. Now imagine getting that stomach ache from simple foods such as pizza that you love and not being able to have a cure for it. I remember the day just like it was yesterday. We were sitting in the hospital lounge, my parents, my older sister, and I, waiting for the results of my little sister's colonoscopy. The doctor walked out and looked at both my parents. He explained that my little sister has something called Crohn's disease. I at the time didn't know what it was, but my mom started crying, and so do I. Little did I know that that entire day would change the rest of my life. Emily, along with the rest of my family, didn't know too much about Crohn's before the diagnosis. Emily was diagnosed with Crohn's at the age of 11. She was always underweight, just like I was, so my mom never thought anything of it. Luckily, we were blessed, and her disease isn't as big as most. She only has flare-ups occasionally, and when she does, she just takes her medicine, takes a few days off school, and regains her strength. She has gotten really good at taking her medication every single day, and it's made her mature a lot at the age of 16 that she is now. She goes and gets blood work once a month in order to keep up with her diagnosis, but was recently diagnosed with something called liver disease, which is also commonly associated with Crohn's. My mom did one of the stupidest things that you can do when you find out that your daughter has a disease. She Googled it. I will save you guys from that mistake and give you a few simple tips on what Crohn's disease really is. People don't know the symptoms or what it really is, and there's a diagnosis that includes a colonoscopy or some blood work that can be done. There is no cure, but there are many medications that can help relieve some of the pain. Some people turn to steroids in order to help their pain, and Emily tried this at one point, but her body rejected them. Others use things like my little sister does, called Pentasa, which has actually ended up working out really well for her. There is no cure, and there is hardly any cause. Although the cause of Crohn's disease is unknown, considerable progress has been made in the recent years to unravel the pathogenesis of the inflammatory process seen in the chronic idiopathic inflammatory bowel disease, says the book called Therapy for Crohn's Disease. Some believe that it's genetics, and even though there's not been none in my family, that is what some of the doctors will say. And also they'll say it can be triggered by stress through your genetics, but I don't really understand what an 11-year-old could be stressing about. The Crohn's and Colitis Foundation of America states, symptoms may range from mild to severe. Because Crohn's is a chronic disease, patients will go through periods in which the disease flares up. It's active and causes symptoms. These episodes are followed by times of remissions, periods in which symptoms disappear or decrease, and good health can return. In general, though, people with Crohn's lead full, active, and productive lives. Living with Crohn's disease is a constant battle, but one that can be done by anyone. Cases of hospitalization have been really heard of, and I've heard of a lot since I've noticed the word Crohn's disease throughout my life. There are people that are in or out of the hospital and will stay in for months at a time only to get a few days of relief out of it. Most of the time it is under control by most people, and it can be monitored by eating right and taking your medications. There is also something that my little sister attends called Camp Oasis, in which she gets to go for a week with a group of people that also has Crohn's disease to a camp, where they get to spend the entire week together having fun and doing things that normal kids without the disease would do, just a lot more bathrooms. Philanthropy events have been held in order to raise money for the disease. There was also one held in Zanesville campus of Ohio University, and it was a walk for a little boy that is 4 years old, says the Zanesville Times reporter. Emily was 11 when she was diagnosed, but doesn't let the disease control her life. Crohn's may not have a cure or a known cause, but it does affect people's everyday lives, whether it's their own lives or the lives of their loved ones. Crohn's disease affects more people than one would guess, and it's important for everyone to be informed of such disease. Life's hard enough without having a disease, and Crohn's disease is something that affects 1.4 million people in this world, and it only takes one cure to change all those lives. Please spread the word on the disease and the developing of cure for Crohn's disease. Thank you.